Good afternoon, everyone, and welcome to AICC's special session today, COVID-19 face masks and PPE during the COVID crisis This is being put on by emerging leaders, and it's also being sponsored by Gemini North America. I am Taryn Pyle, and I will be the host of the call today. If you are new to AICC members, I want to welcome you. We have a few housekeeping details before we get started. This is going to be 60 minutes long. A link to the recording will be available at the aiccbox.org/COVID site on our website the Monday following the call, along with any materials that were discussed or might have been offered. In the event we go over the time allotted, any other questions can be sent via email, and AICC staff or the presenter will follow up individually. Just so you know, with technology, there's always some sort of a problem. If you're losing a connection or have a problem viewing anything, probably it's a problem on your end, so you might want to sign off and sign back on. As we begin, please remember AICC is an international trade association, and as such, members are bound to uphold the letter and spirit of all applicable competition and antitrust laws, including those of the U.S. and Canada. During this meeting, therefore, there will be no discussion allowed concerning prices, customer or market allocations, specific accounts, discounts, terms, and all other matters prohibited by law. That's a mouthful for me. We would have to end the call immediately if there's any violation of antitrust laws. Before we get started, I want to just introduce you all. If you haven't been on a call with us before, if you take your mouse and scroll down to the bottom of this site, you will see several icons. One is mute or unmute. Just so you know, you will all be muted during the call except for those that have signed on to be presenters. There's a video icon. You can start or stop your video. These two sections are really important. Where it says participants, if you click on that, it will list everyone who's on. But at the very bottom of that box, it says raise or lower hand. That is how you raise your lower hand. With this many people on, it's very difficult to see you raising your hand in your screen. So we ask that you use that mostly if you have a special response or a response to a question that's being asked. If you have a question, we ask that you click on the chat bubble. That will open up, and at the bottom there's a section that says type message here, and you can send a message to everyone in the meeting, and we will then call out the questions. Cassie or Daniel will be calling out the questions for response, and also calling on the panelists on the call for responses. But if you have a specific response to something or something that you feel you want to add to the conversation, please raise your hand so that we can call on you. If that's it, I want to turn the mic over to our gracious sponsor of this session, Garrett Bradley of Gemini North America, to introduce the presenters. Garrett, welcome. And again, thank you. I wanted you to know your sponsorship is helping us to continue to offer these classes at no cost. And also, I know that you guys are doing something kind of special for anyone in the industry. You are selling these face masks in any particular quantity, but also donating 1 million of them to first responders, correct?
That is correct. So I kind of got into this by accident, to be honest. I have my other company, Barbrand. We sell digital printers, and I come from the packaging space. And after this all started, I had a customer of mine that I used to sell packaging to had called me and said, hey, we need to get some of this PPE material if we can for our employees. Do you know where we can get it? Do you have any ideas? You guys used to sell supplies, and I really didn't. But I went and just started looking around and sourced some stuff out of China. Long story short, kind of went out to a few of my other friends. They said they were interested. I got 100,000 masks, and the next week it was 200,000, and it was 500,000, and now it's 2 million masks on order. So it's grown exponentially, and so it's definitely something that I think is important for us all to be talking about, and how we're going to handle it, and kind of what time frame everybody sees. It'll probably be different in every state. It's different in could be every municipality. You just, there's so many things going on out there. There's so much information that's flooding in about this stuff. And so I think this hopefully will shed some light on, at least, if you do need this material, where you can kind of go to get it. I'm certainly not the only person out there doing it. there's several other options. I'm happy to point people in that direction too. I mean, the number one thing is to try to provide for the employees that are in here working for us the best support that we can give those guys and keep them healthy. So that's basically how I got into it.
Thank you, Garrett. Cassie Malone is a customer service manager for Corrugated Supplies Company. She has been with the company for 7 years and is currently serving as an AICC Emerging Leader Board Delegate along with David Brett Schneider. Cassie has a 2-year-old daughter, so when she is not working, she is enjoying time with her family. Again, I bet you're having a lot of time with your family right now.
Oh, yeah.
Daniel has been Corrugated adjacent for over 15 years. After helping in the family business throughout college, he joined as a full-time sales agent and service technician in 2010. Since then, he has helped to grow the operation into a nationwide sales, installation, and service company. He now serves CST Systems as Vice President of Operations and serves the AICC as one of the Emerging Leader Board delegates. Like every other millennial, he has been spending his time in lockdown learning to bake bread. Oh my, Daniel, you got to send some my way. Anyway, welcome, and you guys, so thankful for you're putting this together. You guys are just amazing Emerging Leader Chairman, and I'm glad to be working with you.
Thank you very much. Hello, everyone. So we just want to say thank you to AICC Emerging Leaders, staff and members that are joining us today for the Facemask and COVID-specific PPE webinar. Daniel and I have had some really big plans for emerging leaders this year, some of which that have gotten slightly stalled, due to this global situation we find ourselves in. With that, we're still trying to find unique ways to deliver content and create value for the group as a whole. So that's where this webinar came into play. We've been listening to the AICC Friday COVID calls the last few weeks, and face masks and proper PPE were always coming up, always a question. And now with more mandates coming down the line with, this potentially being required for essential employees, we thought it could be a good webinar topic to really hone in on and hear from some great speakers that we have that are going to share some of their best practices and what they've seen. And then with this, at the end, we're going to have, a question and answer. So as you have questions, just make sure you're typing them in the chat box, and we'll make sure that we go and get to those at the end. Also during this, we really want to focus for emerging leaders. We're trying to give you guys the opportunities to bring this information back to your own organization so you can help lead this implementation. During this time, it's really been a great opportunity to demonstrate leadership wherever possible. So we're just trying to give you some more information and resources to be able to do that. Without any further ado, I'll turn it over to Daniel so he can share some of his thoughts as well.
Thanks, Cassie. You said about everything I want to say here. To the emerging leaders, as you know, your senior management has been very busy in this time, and everything that you can do to step up really shows up as we talk to the people on the board. They're looking for who is rising to make a difference in their organization as things are not what they predicted. We should also mention what the AICC existing resources are, Cassie?
Yeah, so right now on the website, the AICC website, if you go to aiccbox.org/COVID, they have all sorts of resources there. Specifically, they have a source for all masks, face masks that we've been able to, find. They've got links on there for where you can get them, certain lead times. So it's a really great resource specific to, this call. So we'll also send that information out after the meeting as well. With that, let's just dive right into our speakers so we can get this started. First off, we're going to go over some of the legal ramifications. So Taryn, is David Ghosh on the line, or David, are you on?
Taryn, you have to unmute.
Can you hear me?
Yes,
Oh,
we
yep,
can,
there he
David.
is.
Yay, there you go. And how's everybody doing? I can see all of you. What a good looking group. That's why I don't have my camera on, because I would taint the pool. It would be terrible, because I'm not shaving, and I've also decided I'm not going to comb my hair until this is all over. But let me just give you sort of a stream of consciousness rundown on some legal issues, concepts, ideas for you to consider. Needless to say, and I have to provide this disclaimer, I'm not providing you legal advice. I'm just providing you thoughts and observations. It's up to you each individually to consult with your own attorneys or advisors to find out exactly what is the right solution for you. That being sort of the typical disclaimer, the next is just a real practical observation. Everything with COVID-19, this situation is so dynamic, so fluid. There's new governmental measures each day. So truly, my disclaimer aside, you really have to be on top of this day by day and make sure you're getting the most current information. All the state and federal agencies are pushing out new guidance, interpretations every day. So that being said, as suggested, there are a lot of players in this, a lot of state, local, federal agencies, CDC, OSHA, and more they're trending requiring or recommending the use of masks or face coverings in the workplace. And this is expected to continue. The jumping off point to all this, although it's not specifically mentioned, is OSHA's the Health Act of 1970 and the General Duty Clause, which mandates that employers provide a workplace that's free from recognized hazards causing or likely to cause death or serious physical harm. That's the overarching federal mandate, but at a state level, at last count, New York, New Jersey, Connecticut, Maryland, Pennsylvania, Rhode Island, DC, Los Angeles City and County, Northampton, Massachusetts, Miami-Dade County have now taken upon themselves, and they now require or recommend the use of masks or face coverings in the workplace as a result of COVID-19. Again, wherever you're located, you want to see what your state or city or municipality is doing. Just some examples, like New York's order requires essential businesses to provide employees with face coverings and to wear them when they come in direct contact with customers or members of the public, and specifies that the businesses must provide the face coverings at their own expense. Until, right now on April 3rd, CDC said at a federal level, they're not recommending the use of cloth face coverings, but this changed when CDC issued guidance with respect to essential employees, which now is in place for 14 days that you must wear it. And again, this is just going to the fluidity of this situation. So, some general guidance that you want to consider on whether you implement a policy or not. California employers should be aware that Cal-OSHA just put out their own guidance regarding aerosol transmissible diseases. Now, I guess maybe I should back up and give you a little insight in the difference between a face mask and a face covering. Face masks are either a filtered respirator such as an N95 or K95 or a specialized medical grade or surgical mask. And these are the ones that you're hearing about. There's where the shortages and the supply chain issues. So generally right now they're being reserved for healthcare providers and first responders. These are unique creatures. They are themselves subject to OSHA's PPE standards and the OSHA respirator protection standard. And I'll talk about those in a minute, but surgical masks are not considered respirators, but would likely be subject to all of these others. These are for the highest level of possible contamination. Now, a face covering is, I think, what a lot of folks are now doing, is a scarf or a self-created cloth, a bandana, other material that they're using to cover an employee's mouth and nose. And the CDC has specifically listed 5 criteria for a face covering. That 1, it fits snugly but comfortably against the side of the face. 2, it can be secured with ties or ear loops. 3, it includes multiple layers of fabric, and I think this is where a lot of folks are not following the guidelines. It's just they're just using one layer. It allows for breathing without restriction, and it needs to be able to be laundered and machine dried without damage or change to shape. So again, single cloth layer, single use paper-based covering, which does not meet the above criteria, and it is not adequate. The difference is the face mask is a mutual protection for the individual wearing it as well as whomever they're coming in contact with. The face covering it's not intended to so much protect the employees, but to protect against transmission. It's only a measure which employers must take in some jurisdictions, but you need to understand the distinction. Again, the terminology will be important with regard to what you end up doing if you do anything. Now, the third type, which you're only seeing in unique situations, is the full face shield, the plastic, and that's still just been reserved for their traditional normal uses, and employers really haven't been expected to even approach that. Now, the question then begs, can the employer require an employee to wear the face mask? And again, not a legal interpretation, but right now my short observation is you can't require someone, but it appears as though right now there's enough guidance out there that as the employer, you can certainly recommend it. The CDC is recommending that, public, if you go out in public, you voluntarily wear a face mask or face covering. So I sort of extrapolate that out, that also employers can do that. Now, they went beyond that because OSHA provided some COVID-19 guidance in which they identified 4 levels of occupational risk with varying levels of PPE required at some. There's the very high, medium, and low risk level, very high and high risk categories. They do mandate respirators. The N95 masks are better. And generally those are employees that are, healthcare workers, first responders, mortuary workers. The lower risk categories include those employees who do not require contact with people. And this is kind of, to the point where whether it's voluntary, they literally get into people who are working at home. So it seems odd or counterintuitive to me that you're telling people to work from home, but then you're saying our policy is while you're working at home, you should be wearing a mask. So that's how sort of the fluidity of all this is. Or even if you're working in an office that's closed. My office in DC, we're technically closed, but we have, someone rotating in every day and getting the mail and doing other things. The medium risk, that middle group, includes what I think would be our industry. And the examples given are grocery stores and workers who are in frequent or close contact with people, whether it's customers or other employees who may be infected, but are not known or suspected patients. And, again, the CDC, if you read it and you're sort of following the trend line, although it's not an absolute mandate, I would say it's a very strong recommendation that those individuals need masks. So wrapping this together, I look at it as, although it's not absolutely directly being mandated by the federal government, this may be different. Again, look to your local jurisdictions. In our industry, it should be a strong recommendation in the workplace. Again, I'll push off some other issues about other considerations because these laws are not existing in a vacuum, and I think a lot of people are ignoring that. So, basic questions you might want to ask in your workplace, in terms of determining if you have a policy, the scope of the policy, is what category do you fall in? The very high risk, medium. Some of you may be in unique situations. I'm not going to assume that all of you are the medium level. And this is a bit of self-determination, because unless you are clearly a healthcare provider, the high risk category, which gives it as an example, you have to assess your situation. Another question, what type of mask coverings should you consider? I think this is as much a practical consideration about whether or not N95 respirators are available, and if it's something you'll be able to access. Otherwise, then you get into the situation of you have to make do with what's happening. What you can either purchase or whatever employees are able to manufacture themselves. That too we'll talk about, because if you're not able to access them, employees are making them themselves. That's to cut the chase, that's compensable. The time that an employee spends to manufacture their own face covering, as well as the materials that they use, the jurisdictions are making it pretty clear that that's time on the clock, as well as it's reimbursable. Beyond that, if you fall into sort of these higher level categories, if masks are going to be, quote, mandated, have you considered the required safety controls? Then again, you look at OSHA and how they impose other, and I think on one of the town halls that was referenced earlier, we talked about this. Is it safe? Is it safe to be used in the environment, the manufacturing environment in which you're working? Do the hazard assessment, consider whatever alternative options you have to protect employees, things of that nature. That's what's going to be good. Sort of, if you find yourself in the gray area of you're not mandating it, what if, or even if you're not even addressing it, what if an employee asks to wear a face mask voluntarily? I think, this is one of those situations that you err on the side of, if you do the safety assessment, why wouldn't you? But OSHA does have voluntary use requirements in their respiratory protective standard that you may want to familiarize yourself with, because you don't want it to be that, again, they're wearing something that isn't appropriate, that's unsafe, or isn't providing the protection. They use a single layer of fabric that then, someone's going to say that it's deceptive, or there was an assumption that everyone was safe. And, I'll close out my little diatribe in a minute with some liability notes, but these are things you have to consider. I already mentioned, and I'll say it again, if the employee provides covering, time spent by the employee making it is compensable and reimbursable. So I said earlier about other laws that apply. Right now, just tick off some things, like with the Americans with Disabilities Act. This continues to apply. And the hypothetical that I'll throw out is, what if an employee can't wear a face mask? You're mandating it, but an employee can't wear a face mask because they can't breathe easily through it due to asthma or some other respiratory condition pre-existing. Under the ADA, you have to provide a reasonable accommodation. Thus, you have to engage in the process of working interactively with that employee to see if there is some other solution that's possible. Again, a reasonable accommodation. I'm yet to see this, but it was something that an associate of mine brought up with. I thought it was interesting if under religious grounds it comes into play, whether or not they're willing to wear it or not. Religious objections are covered under Title VII. This COVID-19, as of yet, there's been no waiver of any of the other laws and the applicability. So you need to again factor that in. If someone refuses to wear a face covering and they have no medical or other protected objection, needless to say, then you can, if you are requiring it, do that. But you need to assess all the circumstances. So sort of, I'll finish up my part because maybe the questions things, but I think, just hitting 5 real quick points. Compliance, it seems as though all the states and the federal government, they're trending towards having either some mandate or a strong recommendation about having face coverings. And when they do this, there are fines. That's how states ensure compliance. So be aware of that. So I would be keen to understanding the nuance of if someone comes in and inspects us, you could get a fine for this. Training, we've talked about this for many reasons, for safety in a manufacturing environment, as well as for, you don't want to appear as though, the general duty clause, going back to that at the very beginning of this, that you tell people, sure, it's fine, or we want you to wear face masks, and then they're not properly trained in, how to don the mask, how to wear it appropriately, how to remove it, if it's proper disposal, if there's cleaning, all of the things, from beginning to end of the workday to ensure that, in fact, the desired protection from this product is being delivered, not just to the individual, but to the other employees working around them. I already mentioned it, but cleaning is an important part of it. A lot of, even ones that were technically or explicitly deemed to be disposable, there are guidelines and recommendations for ignoring the disposable aspect and providing advice on how to clean and maintain those for an extended life use. So, you really have to follow that and see what your states are saying. If there's a no wash and wear exception, follow that. But if otherwise they're making suggestions that it's possible, depending upon what your procedures are, you need to work. There are occupational therapists, there are folks, I think, that are providing that guidance. Closing out, sort of the liability note, there's obviously growing concern about a liability as employers are in the moment trying to do their best to protect people, their employees, their customers, the public, as well as employees start to go back to work. Whether or not the guidelines have been strictly adhered to, whether or not there's been inconsistency, whether or not the government is going to step in with something to help avoid claims of negligence if an employee gets sick upon returning to work, or if someone else is exposing them to it. There's no legislation yet anticipated at the federal level. That's not yet been seen, but some states have actually enacted laws to protect some industries. New York does have a healthcare provider protective law defined under state law, so we're not protected, but just by way of example, it shields the employer from simple and ordinary negligence arising out of COVID-19 exposures. Will these type laws be expanded out to include other, and it's interesting to watch the arc of all this. There was the big push and concern to be included in essential, and now that you're called in there, is there going to be additional protection provided to other essential industries the same way the healthcare profession has? That's yet to be seen. Future laws may address this, but I have no inside knowledge nor guarantee it will. So, full circle, what employers need to be doing is doing their best to understand what their states and the federal law is mandating or recommending, and beyond that, then doing their best to ensure they're well informed and they're complying.
Thank you, David. Daniel?
Thank you so much, David. Again, I want to remind everybody that we have the chat box here. If you have any questions that come up, there will be a Q&A session towards the end. So drop them in the chat box and we'll get to them. I can move on towards talking about the kind of masks that are out there, and we'll be referring to Ben Tyndall and Janet Harris to talk about what they have seen in terms of the types of masks and what the benefits and drawbacks of each are. Ben, would you like to start with what your research and what your experience in making masks has been?
Sure. So my name is Ben Tyndall. I am the owner of Tyndall Photographic, which, despite the name, is we're a folding carton rigid box company. Most of what we do is supplying products to the photography industry and photographic entities. But we, at our true heart of hearts, we are a folding carton rigid box. When we stopped operation back in March, we were looking at ways to still be impactful and to still utilize our capabilities. We happen to own a significant amount of non-woven polypropylene, which is a similar material to what's used to make the N95 masks. And so we started developing some prototypes, getting some inspiration from some of our customers doing the same thing. And then we started operation about 3.5 weeks ago and have been selling these masks and face coverings. These items are there's lots of different types of masks and face coverings available. Our specific one is a reusable 2-ply mask that does have an adjustable pleat on the front to accommodate different face sizes and lengths, as well as it has ear loops to securely hold the mask close to the face as possible. So we have, I think from going through this process, what we've definitely learned a lot. I think the biggest thing with the companies that are buying our specific masks, everyone has a different need. What we're selling to and why people are buying our type of mask is that they're looking for something that they want to provide their employees, and that's reusable. So as a business, if I buy X amount, thousands of masks, and my people are throwing them away constantly, there's a waste element, there's a cost element. So I think the thought process behind what we're offering to companies is that they have the ability to offer 2 or 3 masks to their employees, advise them to wash them on a somewhat regular basis, but that they can provide one solution and then not have to consistently look at replenishing orders for masks. And so one of the areas that Daniel had asked me to cover was, why are we providing masks versus asking people to bring their own? So some of the legality issues that were touched on earlier. I think from my company standpoint, when one of my responsibilities I find is to make sure that we're creating a safe work environment. I think part of that is by making sure that we have, in addition to other social distancing measures and measures regarding hygiene, we are providing resources to our employees that would make them feel safe around being in a work environment again. I see a mask as a way to bridge that. I think that I want everyone to feel like they don't have to buy or provide their own. And if I can provide my employees with a solution that I can require them to take care of themselves, as well as have some additionals in case they forget them or something happens, then I think that's a good start. I think the next few weeks are going to be very critical for a lot of companies that are coming back to work, or maybe coming back from half capacity to full capacity, is just managing the stressors and of an environment where people might not feel comfortable at first. And so I think to bridge that gap of, in essence, getting people to be comfortable with being uncomfortable again, while being uncomfortable, is just providing as many visual tools and resources as possible.
Thank you, Ben. Daniel?
We talked a little bit on the call about what you had found regarding paper masks and cotton masks, about absorption and filtration. Will you hit on that real quick?
Absolutely. So obviously there's a lot of different masks out there. I mean, if you go to Etsy or Google or Amazon, you'll see hundreds of listings, right? And so they're all made out of different materials. So we have all of those have different filtration capabilities. They also have different. They also have different characteristics as far as some masks block are water resistant. Some masks absorb water. And when you're talking about a situation where you want to, you definitely want to make sure that you're looking at what it is that whatever face covering or mask it's made out of. So, for example, ours is made out of a non-polypropylene, which is, like I said, it's very similar to the N95 material. We're not marketing these as medical grade masks, but they help block large particle droplets, splashes, sprays, and the design is that it's designed so that, let's say you are in a situation and someone does cough or does something else, it's essentially the hope would be that you're providing better coverage for the individual wearing it from possibly getting sick or being impacted by that. When you have a the standard with regards to N95 does go back to not only the fit and the feel and the material, but also its filtration capabilities. Some masks that you can find on the market have filters. Some masks are some masks do not. I would say most don't. You know, like for example, there's a local company to us called Detroit Stone. They're making masks, and so they're advertising that a cotton mask, a 2-ply cotton mask, can filter out 60% of the particles and that might be coming in contact with the person. Not only leaving that mask if they're wearing it, but also that it's not going to block as much coming in if they're breathing through it. Other materials like the non-woven polypropylene or other things like or paper or whatever the covering is made out of, they all have different characteristics of how well they filter, as well as if they're going to absorb any sort of liquid or water or particles that might be coming in the area. So it's definitely a good thing to research when you're looking for a solution. We're providing some of our material to some companies that are using it as a filter. So our entire mask is made out of the material, but we have a local company that's buying cuts of this material from us, and they're offering it as a disposable filter that they're putting inside of their cotton masks. So we do know that the material does have some filtration capabilities, but again, you really want to make sure that you're looking at what's going to be the best solution for you. There are masks that can be very expensive, but they might be overkill for what your application is.
Thanks, Ben. Jana, would you add to that your experiences on the face shields that you guys are making?
Sure. The face shield specifically?
Or masks and your experience on the masks in general.
Okay. So yeah, Daniel reached out to me last Thursday, and we had a good conversation. And then on Friday, he sent me an email saying that he wanted me to discuss the mask that we are using now, the mask we are making, and whether or not that's mandatory. Well, as of our conversation on Thursday, it had changed from Thursday to Friday because Friday we found out we did have someone test positive. So that kind of shifted what we required and what we were doing. But to tell you what we first started out with was just the cloth mask. Basically what Ben was saying, we had an employee here that brought her sewing machine up to work, and actually it was a labor of love, and we kind of helped out and pitched in, and I was cutting HEPA filters to insert into the cloth mask. So we did offer these up 2 weeks ago to our employees. We did not make it mandatory, but we felt like we wanted to give them that line of protection and that option. Of course, the filter could come out, you can wash the cloth and then reuse it. After that, we were looking at making these face shields. I'm at the carton plant, by the way. I'm isolating myself down here and my sister Janice, who's on the call, and my daughter Jordan, who's on the call. They're at the corrugated plant, but I'm down here at the carton plant, and we're making these face shields to donate 100,000 of them. And so we also have some of these to use as well. So it's just paperboard. It's a group of people that in our industry that have decided to do this and to volunteer to at least donate 100,000 of them. If you're interested in finding out more about this, you can look it up on fibershield.org, and you can participate along with us or just find out more about it and what's going on. So we have those as well for our employees to use if they want to. After we found out that we did have a positive case, we decided, in addition to that, we wanted to go ahead and buy some just plain medical masks for protection. So these are not the N95s. These are not, they're just extra. We bought a couple thousand of them. We were afraid that someone might forget their mask at home that we had made for them, so we just wanted to have a backup plan. So that's where we're at today.
Thank you,
Jana.
Sorry, Karen.
No, I was.
I think that's a really good point about having some backups on hand in case the employee forgets the masks that they've been issued or that they've created. And the face shield may also be a bridge on the ADA issue that Dave talked about earlier in terms of someone having a hard time breathing behind a cloth covering. like to talk a little bit about what you guys are doing for training practice at your organizations, and the sort of policies that you've instituted, and how you're educating your employees about how to use these masks. And I believe, Gene, you had some comments on that.
Yes, thanks, Daniel, for having me. Hi, everyone. Thanks for joining. We're fortunate at this point. Knock on wood, we've had no positive cases. We operate in multiple states, and as Dave Goach had indicated, there's a lot of information as we've seen, just differing rulings across many of the states that we operate in, and it's a rapidly changing environment, and you know, we're just trying to put the safety of our people first, and I think if you can act with that in mind, you're avoiding a lot of the willful negligence of scenarios like this. We're fortunate in Coleman to have a customer that converted their operations to making a multi-layered face covering that has a BFE 95 filter sewn in between multiple fabrics of cotton layers. Obviously not approved for healthcare workers, as David was explaining. We also have disposable surgical masks at some of our facilities, but we've purchased the masks. They are optional at this point. We are recommending that anyone who chooses not to wear a mask at this juncture maintain 6 foot social distance whenever humanly possible. And I believe in a lot of our daily conversations with our general managers, virtually everyone is sticking to that pretty strictly, and we're happy to see that. Employees are they're offered multiple masks that are washable, reusable. We've posted posters that kind of just simplify, you know, hey, 6 feet, inside of 6 feet, please put your mask on. Here's how you care for your mask in order to keep it clean and not contaminate you or any other surfaces in the exchanges of your masks, and to care for them as they're washable. And you know, just continuous communication as much as we can with everybody we have at the staff level. We have a lot of office personnel at multiple plants that are both working with social distancing, people in conference rooms, lunch rooms, with desks set up in the corner. So it's just really a regular communication. We do our very best to provide people with a kind of a 3-pronged approach of here's what we're doing to keep your environment safe and clean. Here's what we can provide you. Here's what we'd like to know if you're uncomfortable dealing with, and how we can help. We did have a couple of employees who were nervous about working in the environment, and they're working from home. So we're fortunate that we're able to do that. That's not plausible in all cases when you have somebody that runs a press. But the mask communication, the posters are about the most efficient way we can quickly broadcast a message at the plant level across multiple facilities about proper care, proper usage, and proper protocol.
Thank you, Gene. I appreciate that. John, we had talked a little about your experience with your positive cases at your plant, and since you guys have gone on with masks as well, are you still on the call?
Who did you call on, Daniel?
John Kochi.
Oh, okay. Yeah, he is.
Yeah, I'm still here. Can you hear me?
Yep.
Yeah, unfortunately, well, welcome everybody. Unfortunately, we had a positive case probably at this point. It might have been 3 weeks ago. It was relatively early. We're in the Pennsylvania area in Montgomery County, which is kind of a hot spot, close to New Jersey, have employees from New Jersey, and, you know, close to New York. So we definitely are dealing with it around here. After our first case, it became real. You know, we It was a third shift employee who had been out of the building for 2 weeks for sickness till we found out that they were positive. So it wasn't all that real. Then a week or so after that, we had another case with a third-party cleaning person. As you can imagine, the person was everywhere. So people were pretty freaked out. You know, we spiked at a high of about 25% absenteeism. You know, and now that has, I mean, you go into a cycle. I mean, people get freaked out, they go out, they go away, and then they start to trickle back. At this point, we're down to about, I'd say 12% absenteeism, and you know, so it's not a whole lot different than a normal day. We haven't had a case in 2.5 weeks, knock on wood, but we instituted before the government did. We instituted mandatory face masks. So we just thought that was the right thing to do. At the time, we didn't have them. We couldn't get them. We have 15,000 of them on order, but they kept being delayed. So we followed the CDC recommendation and had people make their own. Those that didn't, we provided because we made them here ourselves for them. So we've been doing that. It's a 2-ply mask that can be laundered, and we gave every employee, we're going to give every employee 2 masks every other week until we can get a steady supply, and then we'll probably do it weekly. And I think every step you do like that, I think you can see the confidence building in the employees, and they certainly tell us and have conversations. I'm on the plant floor every single day. You know, we have instituted mandatory temperature checks, the masks. We also offer face shields if people want them. We offer gloves if they want them. You know, we've taken stuff out of lunchrooms, so only certain people can be in lunchrooms. So I think they see as we're doing all this that, you know, we do care about what's going on here. We do want to keep people employed and keep our clients helping out the supply chain. So that's kind of where we stand right now.
Thank you, John. I'd like to shift towards other PPE and sanitation measures you're all taking in your plants. And since we've still got you unmuted, will you talk a little about the other things that you guys are doing?
Was that for me again?
Yes, we had about the temperature checks and plexiglass kiosks.
Yeah, we didn't have any gowns, nor could anybody get them, you know, without. So we just, Amazon actually, we went out and saw what Amazon was doing. They created plexiglass booths. We actually just started that this morning. So I was in here at 5:30 this morning just to see how it went. We were figuring it would take maybe 30 seconds per employee because we ask them a series of questions. We ask them to do questions before they get here. And literally it was a non-event. It took probably 10 seconds. You know, we followed, as I see Dave's name came up, we followed all the guidelines that we talk. We did run parts of it by our legal team. And it went over well this morning. Again, I think it's one more step where people say, you know what, you're taking it seriously. We're constantly out on the plant floor because as much as you want to say 6 feet, if you're feeding a press that's got sheets that are bigger than a one-man feed, you're closer than 6 feet or damn near it. If you've got a machine that's down, you're going to have techs and operators trying to troubleshoot it. So it's great to say you're going to maintain 6 feet, but it's difficult to do in the environment that we're all in.
Thanks, John. I appreciate that. Jana, do you have some additional PPE and safety measures?
We're doing a lot of the similar things, to be honest with you. But what has changed from when we found out we had a positive to now is we have fewer people in the office. It was an office personnel person. We've also restricted where no one from the plant can come into the office and vice versa. So we have an inbox and outbox right out by the door. So even our plant manager is not coming up to the front office to do scheduling meetings. We're doing all that by phone and video cam. We do kind of wave at our friends on the other side of the window, but that's about all. We're doing the temperature checks. We've been doing the no break room for a while. We took the tables down weeks ago. Our employees are going out to their own individual cars during their breaks. We are using the plexiglass in between the packing sections off of the folder gluer, because that seemed to be where they were really getting too close. Even before we were had a positive, we were having our pressmen wear the face shields because they were also violating that 6 foot distance thing. So that was an issue. And then also since the positive test last Friday, we're outsourcing someone to come in and disinfect once a week above and beyond our normal daily cleaning regimen.
Thank you, Jana. Jean, did you have any other measures on the?
We've used outside firms to come in and disinfect our plants, and we communicate that and kind of as John was talking about. I mean, it's really our responsibility to make sure that we can give our people the confidence to come into work in a safe environment. And so, doing those measures and then communicating what we're doing is certainly helpful. We do have a couple of plants that are taking temperatures every day. I'm trying to get someone in the chat room had asked the brand that of the laser thermometers we're using. I'm trying to track that down. But each plant, we've got some plants in some areas where the positive testing of the cases is extremely low. And so we haven't really resorted to that. But it's really from my perspective, it's about communicating to people what we're doing to keep them safe. They want to see action, and we've got a couple of designs on face shields that we've done, and that's certainly helped. Here I think I've got it's an infrared thermometer that they only have a model number, so I'll throw it in the chat room. But it seemed to work out fine, and I do believe people appreciate that.
Thank you, Jean, and thanks for getting that thermometer into the chat room. And finally, Ben, you let us know what other measures you guys.
I'm sorry, Daniel, can you want to know what other measures we're putting in place that we said?
Yes, about marking some space around square areas and other measures that you guys are undertaking.
Sure. So like many companies, we do have some of the temperature guns. The majority of my staff is not back to work yet. They're starting to filter in next week and the week after, but basically we've working with HR to basically put in a protocol where they come in, they have their temperature taken, they sign an affidavit saying that they don't exhibit a list of symptoms, and then we're requiring them to wear masks in place. We've also purchased kind of an obscene amount of hand sanitizer and have stations set up all over both of our buildings, so that when just reinforcing as many visual indicators as possible that hygiene and cleanliness is definitely going to be an important part of what's expected, and also to keep everyone feeling safe. We have taken actions to have our buildings cleaned before the majority of our people come back, and then where we can, we're still going to have about half our staff working remotely. Half of our office team working remotely, and just having absolute bare essentials when it comes to people in the building. We probably will plan on having that in place until sometime July or August, as long as we possibly can. We definitely want to have, there is importance on I think from a team standpoint, reuniting everybody and seeing that, but at the same time, we're expecting a pretty significant hurdle to get over just to get everyone feeling comfortable again. And as many things as we can do and put in place, we're going to. So we had placed an order for, I'm sure some of you have seen the antibody tests that were being marketed a few weeks ago. We were trying to secure those for our team. We do work with some medical companies that have access to those. Unfortunately, the FDA has not approved any of them yet. So that's on pause until the FDA does put those in place. But there are a host of companies trying to come out with these little 15-minute do-it-yourself kits where you can similar to any other self-test that you're doing, but essentially it's taking a prick of blood and then getting results to see if you have antibodies. So as of yet, all those vendors I think are still waiting for approval, but it's something that it is something that we'll also be looking to do in place as well. And so again, if that gives people a little bit of, if that helps us identify who has possibly had the virus or who has the antibodies and who doesn't, that's valuable. But I think it's also, again, more about making people feel comfortable.
Thank you, Ben, so much. And thank you to all of our speakers for getting on here and really helping us understand the specifics with face masks and COVID-specific PPE a little bit more. Since we're nearing the end, we're gonna go through some of the questions that we have here. A lot of them have already been answered in the chat box, so we appreciate you guys answering the questions throughout. So we will make sure that you're checking out the chat box, and then we have a couple that were not answered. So I just want to put this one out there. Do you still need to stay 6 feet away if you're wearing a mask? So I don't know if maybe John, could you take that one since you've had some experience with this?
I don't see him on.
No problem. Or Jana or Jean, anybody that's really been dealing with people working on the machines together. You know, if they're wearing a mask, are they still technically supposed to stay 6 feet apart?
We recommend that, yes. We encourage them to do that.
Sorry, Jana. Yes, same principle. We're strongly recommending it. It's a challenge in some spots. It's going to be. So we've really worked hard too to try to keep same crew sets together. Very similar to like what happens in your own home, to try to keep some consistency.
Thank you. And then some questions about what thermometers were being used. Both Jean and Janice have answered in the chat box, so you guys can get some links to the thermometers that they're using right now. One other question that we did receive, and this is more for AICC staff, is if we have masks that we want to get out on the AICC site, how do we go about doing that?
Mike, I'm going to call on Mike for that.
Just let any AICC staffer know, and we'll make sure that it gets to the key links page. And on the key links page, we have a whole listing of AICC members that are offering PPE in any way, shape, or form. We've got it. Listings there from the most recent one, which is Garrett and Gemini North America's listing of what they can do, to I think one of our first ones was somebody who was going to be able to procure hand sanitizer in 55-gallon drums, because I think that as we get to the new normal, hand sanitizers are going to be a big part of life going forward. So get it to me or any AICC staffer, and we'll make sure it gets on there.
Okay. Thank you. And lastly, we just want to say thank you to everybody for listening in, and thank you to all of our speakers for being on this call and sharing your insights. It is so valuable. We really appreciate you taking the time to do that. Going forward, make sure that you look at the aiccbox.org/COVID, as they have plenty of updates there, especially mask sourcing information that I think will be very valuable after this call. And lastly, just a little plug here for emerging leaders. Next Thursday, we have our CRM webinar. It's at 2 p.m. Eastern. So it's free to emerging leaders, and it's open to all of AICC member companies. So just make sure you are registered for that. And other than that, we're going to turn it over to Taryn. So thank you again for joining us today.
Before we go, Gene Marino had his hand raised. I'm going to call on Gene.
Yeah, this is the first time I've got a chance to experience the Emerging Leaders Group. And I guess the one thing I wanted to throw in here is this is just a great exercise in on-the-fly decision-making that you can unpack in your own organization. I think everybody on this call can attest that the decisions that were being made were evolving on hourly, sometimes even faster than that at the beginning of this whole pandemic. And it's a relief now that our leadership team can get on our daily call and there's almost very little change because there's stabilization in what's going on. But it would be a great exercise for you to kind of work backwards in your mind of how decisions were made and communicated in the organization as this thing unfolded. I think it's just a unique viewpoint into almost a post-mortem of how decisions are made and how you do the very best you can do with the information that you have at the time you have it. So thanks for allowing me to participate.
I see a question here from AJ Cooley about what is the Emerging Leaders Program. Cassie, you wanted to speak to that?
Yes, so Emerging Leaders Program is a program within AICC for young professionals, typically 35 or under, that are looking to grow within both the industry and within their organization. So it's a series of trainings, networking opportunities, now virtual networking opportunities as well. So just to get to know and learn from other young professionals as well as experts and veterans within the industry. So if you're interested, go ahead, Darren.
Thank you, Cassie. And Garrett, before we leave again, I want to say thank you. And I was wondering, do you have can you show us what these masks that you sell look like to give people an idea? And just a reminder that you can find a link to Garrett's offer and services on the COVID page under links. And Garrett.
Yeah, so just to reiterate what some of the other folks have had to say, I mean, there's several different masks out there. There's all kinds of different masks. What we've been concentrating on is something that looks like this. So if you're familiar with what they're wearing when you go to the dentist office, it slips over your ears like this. Pull it down over your face. At the end of the day, you throw it away, and the next day you'd have a new one. The next step up from that is a KN95. There's an N95 mask, which is basically similar to this. This is a spec they use in Europe and Asia. The N95 is a primarily American mask, but you'll see it's a little bit different. It has a little piece of metal here. So when you put it on, it seals very close to your face. So that mask is also, it's reusable, but only to a certain degree. So you could maybe get a couple of days use out of one of these, and then you'd have to switch it out. And then the cloth masks, we don't really deal in those. There's a lot of different specs out there. You just want to make sure that you maintain washing them and keeping up with those. If there is any other questions, again, regardless of whether it has anything to do with what we're doing that I can help you with, I've got some information on PPE, anything at this point. I've had people call me with hand sanitizer and all number of things. I'm happy to point you guys in their direction if those are things that people are looking for. So yeah, if there's anything else that I can do to assist anybody in the group, please reach out to me, and I'm happy to push you in the right direction if I know what it is.
Thank you so much, Garrett. I really appreciate it, and I'm very excited to hear that you're giving $1 million away to the first responders. I just think that's a neat add-on to what's needed out there. I want to thank everyone for participating. There were a couple questions. People want to know how to join the Emerging Leader Program. You can contact me, and I'll put you to get in touch with these brilliant emerging leader people we have on the call today, Cassie and Daniel. You guys, Jean said it right. You guys saw a need and you put this together rather quickly, and we've educated a lot of people today. So thank you so much for your participation. I'll look at the AICCbox.org/calendar, and you'll see all the webinars that are coming up, including some relating to sales. So if you're in the sales field, you might be interested in that as well, or you have an employee that's interested. Just as a reminder, these courses are free and everyone can participate. We also have, anytime you participate in an AICC webinar, whether it's for a fee or free, it's available to everyone in your company. It's not available just to one person. So you can have a whole group of people participating at one time, regardless of the cost. And I look forward to seeing you all on our next webinar series. Thank you very much. See you later.